Thank you so much for coming to talk to me today, Kari. I wondered if you might be able to share some of your experiences with rosacea with us all today. First of all, how old were you when your rosacea was diagnosed, and what kind of symptoms were you experiencing?
I was late 30s,
Yeah.
and I had been in the sun a bit, and just sort of a couple of days after, it was just intense burning, and the bumps started coming under my skin.
Okay.
And not like spots, because I never really suffered from that when I was young. So I realised this wasn't right, and then I started touching the skin, and it's like clear fluid, and it was really burning and stinging, and I sort of, that's when it started. Very uncomfortable. Yeah.
Okay, and did you go and see a GP or a dermatologist?
Yes, I did go and see my GP, and gave me some various products, including antibiotics.
Sure.
I was not keen on starting the antibiotic, so I used the gel.
Yes.
Can't remember the name of it, but it didn't really do a lot.
Okay, that was probably an antibiotic gel?
Antibiotic gel.
Yeah. Okay.
And I just tried different products, all really nice products.
Yeah.
The burning was what bothers me the most, and the redness when I was out, and then covering it, it sort of cracked, and so it was quite unpleasant in the beginning.
Okay, so you tried some antibiotics and you didn't find those particularly helpful?
Not antibiotic gel, but then I did come around to starting antibiotics, and I was on that for a long time, and yes, it did help my infection.
Okay.
But I wasn't keen on staying on it.
Yeah.
So
this is a common thing, I think, with people who suffer from rosacea, is this reluctance to stay on antibiotics long term.
Yeah.
And I think the key is trying to find something that helps you manage your rosacea, that doesn't have side effects, and that you can consistently use. Just talk me through skincare. What have you used in terms of skincare? You mentioned that you've used products, some have irritated the skin. Have you managed to find a consistent skincare routine, and has that helped you manage your rosacea?
Oh yes, a lot now. The last few years.
Okay.
And very basic, just a cleanser, moisturiser, and I use powders to cover. I've even been able to start using foundation now that I haven't done for years and years, because it just irritated the surface of my skin.
Right.
So I feel now I'm really managing it.
Good. Okay. Lovely. I know a lot of women will obviously want to know your advice on things like makeup and covering your rosacea. Is that something that you've struggled to do over the years?
Yes, I have, but I don't feel I struggle now.
Okay.
But I did struggle for years, yes. I did come off the antibiotics. I haven't been on antibiotics for a long time, and I'm sure, that's helped me as well, because, that can have other effects.
Sure. What kind of triggers would you say you have? A lot of people with rosacea can very definitely pinpoint things, for example, sunlight or changes in temperature or hot beverages. Is there anything that really brings your rosacea out and makes it worse?
Yes. Definitely change the temperature, because I like the sun, I like the cold sun. I don't sit in direct sunlight if I can avoid it.
Yes, good.
I'm careful on my skin. I do drink wine and drink coffee, because I'm not going to give it up, but obviously that doesn't help, but I can live with that.
Yep. Do you think you've adjusted your life a little bit to perhaps take in less alcohol or to take in less coffee if you know that that's your trigger?
Yeah, definitely alcohol. If you want to feel good, you have a drink. And you always, when you dress up, go out, you want to feel good.
Yeah.
And I have the wrong sort of wine, or what certain wines triggers it off, or particularly champagne, and it just makes me feel very uncomfortable, burning. Intense redness and burning.
I think a lot of rosacea sufferers will really relate to that, because I know a lot of my patients, like yourself, find socialising with a glass of wine very difficult.
It's difficult.
It can bring on the flushing, the redness, the feeling of burning like you were describing. And to some extent it is about trying to avoid those kinds of triggers, to minimise your intake of alcohol, for example. And I know it's difficult, and I know it's difficult when you're trying to conduct your kind of professional life and your social life and things like that. How has it affected you, do you think, emotionally, rosacea? Because you've had it for a number of years now, haven't you?
Yes, it has been times it's been difficult. but more when I had the infections under my skin.
Right.
That was so uncomfortable.
Sure.
Even my eyes got sore. I used to find that my eyes was really, when my skin has a flare up,
Yeah.
also my eyes feel sore, and I was told that could be connected. I don't know.
Absolutely.
Because I'm sensitive.
Yeah.
Anyway, so I think I've got the stress, the food intolerances, which I have got, and so when I go through a stressful time, it triggers it.
Yeah.
And so it's quite a few factors that actually triggers it off.
Yeah, you've hit some really key points there. There is a form of rosacea called ocular rosacea, and I think a lot of rosacea sufferers don't link the skin symptoms that they're having with eye symptoms. So the eyes can feel a bit red, itchy, gritty. Yes. For that kind of rosacea, I always tell people to go and see their GP.
Okay.
Because with ocular rosacea, you should definitely have a doctor managing that and monitoring the condition. Your skin is looking fantastic now, and I know that people, you know, watching this will be interested in what you're using at the moment. You and I have devised some very consistent, gentle, hydrating, replenishing skincare for you, haven't we, that you've been using, always including a sun protector. Are there any tips that you would give any rosacea sufferers about skincare, or anything else that along your journey you've learnt that's really helped you?
Try to seek help. Don't go and suffer. You know, I mean, the products I'm using to cover up my redness makes all the difference. I'm using mineral powders.
Yes. Okay.
And I always check that has no talc in it.
Yep.
Because that really does irritate my skin. And I use a very pale to cover up, and I use a little bit of colour on top. But I avoid the centre where it's really red, so I keep it light there, and I put a little bit darker away from it.
Okay,
I've
great.
also started using a foundation, because I've got a little bit drier skin now, I'm older, so which I never were able to do before, and I put that underneath sometimes.
Fantastic. What about sunscreens? Do you wear
Sunscreen,
a daily
yes.
SPF?
I use a 50 sunscreen.
Fantastic. Every day?
In my moisturiser, it's 50.
Yeah, wow, that's great.
Yeah, it's 50, 30 or 50, but I'm sure it's 50. So I use that every day.
Lovely.
And I cleanse. It's so important to cleanse.
Yep.
I never ever do not cleanse my skin. I even cleanse in the morning.
Yeah,
and
brilliant.
just to moisturise. A very basic routine, but I found something that helped me.
Wonderful. Thank you so much. So I hope that that's been helpful for any of you out there. And one thing I would really advise is that you know, if you have rosacea, or if you think you have symptoms of rosacea, seek help. Go and see your GP. Find a skincare expert that may be able to help. There's certainly plenty of different types of treatments that are available that can help, and perhaps they can guide you through them and talk you through them. Don't suffer in silence. There's a lot that can be done. Thank you.